Okay, so we have Genesis here. Tell us a little bit about what's going on, how long it's been going on, and what you've tried.
Absolutely. I'm just experiencing pain in my scapula, left scapula. Started about 4 or 5 years ago.
Okay.
I honestly don't know what caused it. I played sports volleyball my whole life. I also been in a car accident. Hasn't gone away. I've tried massages, acupuncture. I've tried chiropractic. Definitely has helped, but no good results.
Hasn't resolved it.
Right,
Okay.
hasn't resolved it for sure.
Okay. The SoftWave, what this is acoustic sound waves. And what I mean by that is, what its purpose is to help bring healthy stem cells and exosomes to that area to start to get rid of all the damage, inflammation, the damaged tissue, so it can start to resolve those damaged cells. And then over time, what it does is it helps strengthen that area and stabilize it, so that way, again, you're not having that residual issue over and over again. So, what we're gonna do is we're gonna do some SoftWave on her left, behind her left shoulder blade. We're gonna map it up into the trap because those muscles all tie together. So we'll go up into the shoulder a little bit. Any range of motion that's distorted or hard to do when this is going on?
Absolutely, yeah. When I have like flare-ups, it does, like even lifting my arm, just trying to like sleep in that on that side definitely gets affected. So I try to avoid it.
Okay, so little activities of daily living as far as just like, I'm sure like doing your hair, you know, getting ready, stuff like that.
Absolutely, taking a shower, absolutely.
Okay, so we're gonna go ahead and do some, we're gonna do a trial treatment on her left shoulder, and then we'll follow up after we're done, so that way we can see how she responds and then what the course of action is from there.
Okay.
Cool. All right, so I'll have you go face down there. You want earplugs?
No.
Okay. All right, so it's just the left one, right?
Mm-hmm.
Okay, so I'm gonna tuck this here on the side.
Okay.
We're just gonna open this up. We're gonna trigger basically all through here, that where it's all kind of on the heel side of the scap, and then anything up into here?
Yep.
Okay. I'm gonna untie this.
Okay.
So I can get to that. We're gonna put some ultrasound gel on, so that way, again, we have a lubricant to be able to move around.
Okay.
It's gonna be a little cool.
Oh.
Okay. All right, so basically all I need to know on a scale of 1 to 10 how intense the frequency is when we're doing this. The lower intensities, you know, if we're over healthy tissue, you're not going to feel anything, which is what we want to focus on. If it's damaged, you're going to start to feel almost like it's a little bit more intense. Those are areas we want to focus on because that's telling us that that's where the damage of the tissue is. And so we're going to focus in on those areas. So again, I just need to know 1 to 10 when we're going over these areas, okay?
Okay.
Any questions?
No.
All right, we're going to go ahead and get started. How's the intensity 0 to 10?
No, 0. Like a 4.
A 4? Okay. Is it a deep or is it kind of just subsurface level there?
Now it's getting deeper. So more up you are.
Yep, the higher up you go. Okay. We're going to turn down the intensity a little bit here. A little bit more bearable.
Yeah, definitely. Like a 3, 4.
That's 3 there.
Yeah. Like a 5.
What about into this left shoulder trap?
No, like a 0.
How about right in here?
Like a 4.
Okay.
Ooh.
Right there?
Yep, like a 7.
So what we're going to do is, again, this is good to know because we're triggering that damaged area. We're just going to kind of circle that. Just keep breathing there. We're going to come off it. We're going to come back. How are we doing here?
Yeah, like a 3, 4.
Okay. That's primarily right there.
Yep.
Good, so we're finding exactly where we need to kind of cater this to. And this is the purpose of the trial treatment, is to really narrow this down so that way we're not all over the place, which just allows you to get better results quicker. Good. Keep breathing. 0 to 10, how we doing?
It's a 3. 4, 5.
Okay. That's a healthy number right there.
6, 7.
If we go out here, is it
No.
intensifying?
Oh yeah.
Right there.
Yep.
The medial scapula, or the medial wing of that scapula is
Yeah, definitely felt that. Oh, no.
right there.
Like 7.
Okay. What about right
We're
here?
good. Yeah.
Good there. Middle part of the thoracic spine, how we doing?
No, like a 6.
Okay.
Oh yeah. 7, 8.
Is it tracking with us?
That's fine. That's
Okay.
fine.
So we're right from T1 to T4 here.
Oh, yep. 7, 8.
Okay.
Good.
It's a good hurt, right?
Yeah. So interesting.
Is it dissipating after we kind of hit that
Uh-huh.
first? So yeah, good. That's exactly what we're looking for.
Yeah, we're good. Solid 4.
Okay. Right there though.
Yep. Like a 6.
Okay.
Yeah, still in like 6 right there. Like a 5?
Figuring in on a few muscles there, the teres major, teres minor, which are good for the rotators of the scap. They help bring that left arm up, down, behind your back. How we doing now?
Getting good. Like 4, 5?
Good. That's the goal, right? Your body's going to give you those pain signals, but the goal is for those to, again, minimize and decrease as much as possible.
Mhm.
How about over that middle thoracic spine here now?
Like a 5.
Okay. Anything into the neck here?
No. Oh yeah. Yep. Yep. Like a 6, 7.
Keep breathing. Okay. I'm gonna get you all cleaned up here. So I apologize.
That's alright.
Hopefully not working.
No.
So that was about 500 waves there. So that's,
Oh.
which is about average, especially on like the shoulder area that we want to be in.
Okay.
So
That's so cool.
all right. Go ahead and tie you back up here.
Mm-hmm.
And what I'm gonna be doing is just maybe sit on that one. Okay, go ahead.
Beautiful.
Okay. All right, so now what I want you to do is just kind of take that arm. We're gonna go internal, external rotation. Just kind of put it behind the back. And then just kind of lift off. Okay? Because I know Dr. Kaye had mentioned that you were having some of that trouble,
Yeah.
that struggle when you're doing that
Yeah.
right off. How was that?
I can do it. It's kind of tender though.
It's gonna be, just because what's going on right now is we've activated and
Right.
proliferated a lot of those cells now. So it's kind of like an army, the front line. They're moving and engaging into that direction now. And so that's what's stimulating a lot of healing. Again, you're reducing the inflammation, reducing the pain, but you're now exploiting and really starting to dive deep with a lot of those damaged cells. So,
Okay.
so that's just a discovery visit. That's basically a trial treatment to figure out exactly, pinpoint where the problem is, make sure that we are hitting that exactly right on the nail of the head, or on the head of the nail there.
Mm-hmm.
And the third thing is just seeing exactly how you respond. So that way, again, the specifics of the intensity levels, how many soft waves we need specific for that region.
Mm-hmm.
That puts together a specific plan for you. So,
Perfect.
questions?
Nope.
All right.
Good.
And that was just one visit, so you're well on your way.
Yay.
Oh.